I'm gonna pull the next question also from the Q&A session, and it's really nothing to do with targeted therapy, but I think it's such an important question that we need to address it. And I'll address it to Dr. Sankey because of your work with patient education on clinical trials. So, who pays for participation in a clinical trial? Is it the patient insurance, or does the clinical trial pay for the drugs, scans, administration? Because I do hear concerns that maybe I cannot afford to be in a clinical trial. If we can address that.
Yeah, that's a great question. And unfortunately, it's a barrier that we need to continue to overcome. We really need to advocate as providers and as patients, as patient advocates, that access matters in different ways. So not only access to the drug, but also just physical barriers, right? So logistics to transport and travel yourselves, to stay at a hotel, to get to the center in the mornings, to leave after a long day, and to have that caregiver also be supported. So typically the first question that I would ask is my insurance in network, right? To be able to obtain the treatment on the trial. And oftentimes financial clearance and the department at that institution will run that immediately. So you can find out if you're in network to receive the drugs. But the second thing I would ask the clinical trial coordinator or the nurses to say, does the sponsor of the trial offer just additional funding to allow for myself, for my caregiver to transport, to have lodging, things like that. There are some trials actually, and a lot of pharmaceutical companies now are starting to step up because of patient advocacy groups like Cancer Grace and other biomarker groups, and they are offering funds. So ask those two questions, right? Is my insurance in network? And then are there additional funding mechanisms to support travel and lodging if you have to get to a facility that's not in your hometown?